Hello. Thank you for choosing Orthopedic Center of Illinois for your surgical needs. Please watch this informational video regarding your upcoming surgery. We will discuss preoperative education, what to expect the day of surgery, and postoperative education. Preparing for surgery. 3 to 4 weeks prior to surgery, schedule your prehab visit and perform the exercises at home daily. Schedule an appointment with your primary care provider for a physical and labs. Schedule an appointment with your dentist to ensure you don't have any active infection. Schedule an appointment with your cardiologist if applicable, and discuss the need for holding blood thinners if you take any. Quit using nicotine products such as cigarettes, vapes, nicotine gum, and patches. Obtain a two-wheeled walker, which can be done at your prehab visit. And advance your diet to eat as healthy as possible, build up your iron level, and drink plenty of fluids. Prehab must be done prior to surgery unless you've had a joint replacement in the last 12 months. Bring any unanswered questions as the therapist can work through these with you. Bring your walker if you have one. If not, we will provide you one during prehab. The objective of prehab is walker training, stair navigation, getting in and out of bed or a chair, tub and shower transfers, and car transfers. 1 to 2 weeks prior to surgery, complete your nasal swab for MRSA. This is only valid 4 to 14 days before surgery. You may receive a call from pre-admissions to review your information. Stop taking certain medications and discuss with your primary care physician. Medications like Ozempic, Wegovy, Trulicity, Mounjaro will need held 1 week prior to surgery. Medications such as Ribelsis, Victoza, Saxenda, and Byetta will need to be held the day of surgery. Stop shaving your legs 3 to 7 days prior to surgery. No manicures or pedicures. Prepare your home and continue your exercises learned at your prehab appointment. Preventing injury and complications prior to surgery is important to reduce any need for canceling or postponing surgery. Keep your operative leg free of any cuts and scrapes. Stop shaving your legs 3 to 7 days prior to surgery. Again, no manicures or pedicures to prevent infection. Be sure to keep pets from scratching your legs. Avoid injury to your legs when working outside. If you have any cuts or open sores, contact our office immediately. Preparing your home, like removing obstacles, small rugs, furniture, to make sure your walker fits through the doorways and around your home. Freeze ice packs to use for after surgery. Have medications ready for your return home. Gather pillows to use for elevation and sleeping. If necessary, install handrails in the stairwell or grab bars around your toilet and shower. Packing for surgery, you should bring your photo ID and insurance card, a current list of your medications and the last time you took them. Living will and power of attorney paperwork is optional. Comfortable clothing and walking shoes. Bring your walker into the facility, and a CPAP and BiPAP. The night before surgery, you will drink 20 ounces of Gatorade, clear or yellow, Gatorade Zero if you're diabetic. You'll be provided 2 packets of antimicrobial soap. The night before surgery, you'll wash head to toe with your normal soap and shampoo. On a fresh washcloth, put 1 packet of your antimicrobial soap. Washing chest, arms, back, and legs. Let the soap sit on your skin a couple minutes prior to rinsing. Fresh pajamas after your shower and bed linen if you can. Do not eat or drink anything after midnight except Gatorade. Get some rest and pack your items. The morning of surgery, you'll drink an additional 12 ounces of Gatorade, completing it 2 hours prior to your provided arrival time. You'll use your second packet of antimicrobial soap, same guidelines, chest, arm, back, and legs. Step out of the water a couple minutes and step back in to rinse it off. Take medications as directed with a sip of water. And your arrival time is at least 2 hours prior to surgery. You'll check in at the designated area. At the Orthopedic Surgery Center of Illinois, you'll check in at the west door, second floor, At HSHS St. John's Hospital, you'll check in at the Pavilion, 2nd floor. At Springfield Memorial Hospital, you'll check in at the main door to the left that says Surgery Check-in Services. And at Jacksonville Memorial Hospital, you'll go in the main door. Upon arrival the day of surgery, the anesthesia team will see you. They will discuss the risks and benefits associated with anesthesia. If you've had issues with anesthesia in the past, please let them know. For hip replacements, preferred anesthetic is a spinal anesthetic. The benefits of spinal anesthetic are less nausea, faster wake-up, less grogginess, reduced postoperative pain due to the numbing effect, and reduced risk of blood clots and blood loss during surgery. A risk associated with spinal anesthetic is a drop in the blood pressure, and headaches can occur, and tenderness at the site. If spinal anesthetic cannot be provided, they will use general anesthesia. General anesthesia is a combination of medications that put you in a sleep-like state before surgery. This can cause grogginess, nausea, and slower wake-up. Plan to have assistance 48 hours following surgery upon returning home. Arrange for help with household chores, grocery shopping, and meals. Make arrangements for your pets. Therapy is not necessary after a hip replacement. You will complete your exercises 2 times a day that were provided to you in prehab. Again, there is no need for outpatient physical therapy after your total hip replacement. You do all of the therapy by getting up and walking throughout your home. Upon your return home, sit up in a chair the evening of surgery. Don't sleep in the chair the night of surgery. Move around your home every hour unless you're sleeping, and rest is important. Pain, swelling, and too much activity are all related. Make sure you rest. Apply ice or other cold therapy to reduce swelling and pain in 20-minute intervals. If you notice increased swelling, you may use compression on your lower extremity, such as an ACE wrap. Elevate your lower leg above your heart to help reduce the swelling. Do not elevate in a recliner or ottoman. Use the couch or bed. Use pillows to elevate your lower extremity above your heart, as pictured. Hang your heel off the edge of the pillow and pump your ankles during elevation and rest for circulation. Nutrition is also important postoperatively. Eat as healthy as possible, build your iron levels, and drink plenty of fluids. Use pain medication as directed. Do not use additional Tylenol or acetaminophen while taking pain medications. Use a stool softener like Colace while taking pain medication to avoid any risk of constipation. If you have constipation, you may use a laxative. Common laxatives are milk of magnesia, Miralax, or Fleet's enema. Take aspirin as directed by your surgeon. Do not set alarms for pain medication when resting. Take pain medication once you awaken, as rest is important. Injury and complication prevention after surgery. With any surgery, there is always a risk for a blood clot in your lower extremity or your lung. A lower extremity blood clot, also known as a DVT, signs are increased swelling in your thigh, calf, or foot, pain and or excessive tenderness in your leg or calf that is not reduced with exercise or medication. If you experience any of the above, please contact your surgeon's office. Prevention of a DVT is being active and using blood thinners as directed and repositioning often. A pulmonary embolism is a blood clot in your lung. Signs of a pulmonary embolism are new, sudden onset of chest pain and or shortness of breath, unexplained anxiety, especially when breathing. If you experience any of the above, please go to your nearest emergency room. Preventing a pulmonary embolism, again, is being active, using blood thinners as directed, and repositioning often. Signs of infection are increased redness, heat, or swelling around the incision, persistent fever greater than 101 degrees Fahrenheit, chills, foul drainage from incision, increasing incisional pain. Use proper hand hygiene at all times and ask others touching your surgical site to do the same. Do not soak your incision. Prevent injury to the extremity like scratches or cuts to prevent infection. Be cautious. Your surgical leg may be weak, so ask for help to prevent falls. Pain medications can cause dizziness, so sit on the edge of your seat prior to standing and walking. Use your walker to move around your home for safety and remove obstacles from your home. You will be provided follow-up appointments after surgery with your surgeon, their nurse practitioner, or physician assistant. You will likely have x-rays taken at your follow-up visit. Dr. Allen, Dr. Church, and Dr. Molshine allow you to shower on day 1. Dr. Heron and Dr. Sharma allow you to shower on day 2. After showering, dry your surgical leg really well prior to covering and getting dressed. If drainage occurs, cover the gauze and reinforce as needed. Please call us with any questions at 217-547-9100. There is always a physician on call after hours. Before you decide if the urgent care or emergency department is needed, please contact our office and we will help work you through your questions or concerns. Again, thank you for choosing the Orthopedic Center of Illinois. We look forward to assisting you.